James Stocks. I'm president of the Carroll County NAACP, and I'd like to welcome all of you to our program tonight. Our health committee is putting this together. There's a lot of information that needs to be shared with regard to COVID and do's, don'ts, myths, things that can be cleared up, and hopefully it will be very informative to you. And we ask that you please remain muted, keep your microphone off, and if you have a question, please type your question up in the chat, and we will go from there. So at this time, I'd like to introduce our co-hosts, our co-moderators for tonight, Dr. Velma Lucas and Dr. Charlie Rouse. It's yours, doctors.
All righty. You first, Dr. Rouse.
So good evening, everybody. My name is Charlie Rouse. I'm a local cardiologist and I've been in practice for several years here in Carrollton. Thank you, first of all, for taking the time out to be with us this evening. Our focus is mainly to discuss vaccinations for COVID-19 and to talk about any other topic that may be appropriate for you to discuss regarding COVID-19. But before we get started, I want to reiterate a couple of things that Mr. Stocks said. Number one, please mute your device, no matter what your device is, iPhone, computer, whatever the case may be, but please mute your device. This will allow us to have a more productive and uneventful evening. Secondly, he also said that if you have a question, type it in the chat and we'll do our best at responding to your questions. We promise to be honest and to give you our best response. And then thirdly, we want to encourage you to always speak to your personal physician as the final authority on any medical advice that you receive or that you're seeking. All of us have been tremendously impacted by COVID-19, and what you'll hear tonight is a lot of stories surrounding that. One interesting thing that's come out of this series that we've done, this panel discussions that we've done, is that we've had a number of people who have indicated that had they not heard the discussion that we were having, they may not have gotten the vaccination. So we appreciate all of you and your expertise that you're going to share tonight. At this time, I'd like to introduce a co-moderator, Dr. Velma Lucas, and after which we'll allow all of the panelists to introduce themselves and their specialty.
Thank you, Dr. Rouse. Good evening. I'm Thelma Lucas, a local gastroenterologist here in Carrollton. I've been practicing here for a number of years and have seen more coronavirus than I would ever want to see in my life. So I want to start out with just a little bit of stats. So we know that this is a global pandemic and, the numbers are changing every day, but we're over, 100 million cases of coronavirus worldwide. Of that, the US is leading the way in coronavirus infections and deaths. About 27 million people here infected, and we are fastly approaching 500,000 deaths due to coronavirus. If we look at the state of Georgia, 950,000 cases, and then get the cases, and again, these numbers are changing daily. What we do know, though, is that this virus, we know that it disproportionately affects Brown and Black people, and that's why we're here to discuss the vaccine. So we know that Blacks and Hispanics are disproportionately affected, more likely to get coronavirus, more likely to die from COVID-19 if they contract the virus. On some of our previous sessions, we talked about the whys. Why are Black and Brown people more likely to contract the virus? So just very briefly, we're more likely to work in these frontline jobs that you can't do from home, more likely to be bus drivers, work in grocery stores, these places where we're likely to be in contact with a lot of public. Some of it has to do with housing, some of it has to do with access to medical care. So there are a number of reasons, underlying health conditions, a lot of reasons to get and die from COVID-19. So we've been doing the masking, the hand washing, the social distancing, and we see that that's just not going to be enough. And so I was very excited when these vaccines became available, because now we can talk about preventing getting COVID-19 in the first place, rather than focusing on how do we treat it, how do we keep people alive, and looking at so many deaths related to that. So tonight we want to answer your questions related to the COVID vaccines that are available. We hopefully will dispel some myths that are out there. Hopefully we'll provide some good information, because there's a lot of disinformation, misinformation out. And so that is our goal tonight, to just be able to discuss this, especially for those of you that are vaccine hesitant. And I hope that we can answer your questions. So with that, Dr. Rouse will call the names of the panelists, and you'll each give us a brief synopsis of yourselves. Okay.
All right, Dr. Shatita Edwards. Shatia Edwards.
Good evening, everybody. I'm Dr. Shatia Edwards. I am an obstetrician and gynecologist, and I'm at Carrollton OBGYN. Newer to the Carrollton area, even though I'm a Georgia peach, but trained up in Michigan and then came back down here to Carrollton. So just looking forward to hearing from everybody and answering questions as it relates to the OBGYN world.
Thank you, Dr. Edwards. Dr. Floyd.
Yes, my name is Dr. Gregory Floyd. I've been practicing in Carrollton since 2003, so I've been around for a little while. I practice at Professional Park Medical Services in Carrollton. I'm a family physician. So I've been on the front line. We also take care of our own patients in the hospital. So we've seen not only what goes on in the office, but also in the hospital as it pertains to COVID. And we're happy to be here to dispel any rumors or help you understand the different things you can do to protect yourself, not just with the vaccine, but in other ways. Thank you.
Thank you, Dr. Floyd. Dr. Jerome.
Hi, my name is Tanisha Jerome. I live in Villa Rica. I'm the chair of anesthesia here at Tanner. I've been in the area since 2005. Happy to be here tonight.
Dr. Glass.
Good evening. I'm Dr. Richard Glass. I've been practicing in the Carrollton area for, not Carrollton, but Villa Rica area for 11 years. I'm a family practitioner, board certified. I have a background in research, and I primarily practice out of the Tanner Willowbrook facility, taking care of our psychiatric patients over there.
Dr. Howard.
Hi, my name is Alicia Howard. I'm a staff anesthesiologist for Tanner Medical Center. I've been here working for Tanner since 2008, and we work out of all three of the major hospitals. So I service Villa Rica, Carrollton, and Higgins, Georgia.
Dr. Pham.
Hello, I'm Angela Pham. I'm really happy to be here today. I'm the rheumatologist at Tanner Rheumatology Specialists, the only one. I know I'm really excited to be part of this panel because COVID and autoimmunity and autoimmune diseases has caused a lot of distress, I know, in our community, and I'm happy to be here to clarify anything or dispel any false rumors. And I know that my patient population is high risk, so I have a lot of good updated information, and I'm very happy to be here.
Dr. Prempray.
Yes, good evening. I'm James Prempray. I'm an internal medicine physician, hospitalist, mainly servicing the Tanner, Carrollton, and Villa Rica areas. I've been in Georgia for 9 years, and I'm glad to be back. Glad to be part of this panel and to give any information, any dispel any myths, and give the perspective of a doctor taking care of hospitalized COVID patients. Thank you.
Dr. Spraggins?
Hi, I'm Kirsten Spraggins. I'm one of the staff anesthesiologists, and I practice at all three of the larger Tanner facilities in Tanner, in Carrollton, Billerica, and Bremen. Very glad to be here and answer any questions that might help everyone get better and let us get through this.
And last but not least, our special guest, Dr. Laura Larson.
Thank you. I'm Dr. Laura Larson. I practice infectious diseases. Can y'all hear me now? This is Dr. Laura Larson. I practice infectious diseases, and I'm the medical director of infection prevention at Tanner Health System, and I'm the chairman of the Carroll County Board of Health as a liaison for Department of Public Health.
Thank you. Dr. Lucas?
All right, so we are going to start with some questions that we have, and in between, as participants are putting their questions in the chat, we will intermingle some of those questions as well. So the first question that we have is, why do people get COVID-19 after the vaccine? So we've been preaching, take the vaccine, get the vaccine. We've seen in the news a couple of people that have gotten it, and we know that some people have gotten sick after. So why do people get COVID-19 after getting the vaccine?
So it's important to note that it takes a while for your body to develop immunity after vaccination. And currently the released COVID vaccines, there are 2 steps to it. So you can get COVID after the first vaccine because the first vaccine is only 70% effective. So that means that there's a 30% chance you could still get COVID if you had an exposure. But after that second vaccine, the efficacy goes up to 95%. And so that's why you can still get COVID, but you need to make sure you've waited at least a week or 2 after that second vaccine for you to have full efficacy. And it's really, really important to note that even though the vaccine has a 95% efficacy, it's 100% effective at preventing severe disease and hospitalizations and death. And that's very important to note. That's the big take home about it.
The next question is centered around whether or not you should continue to wear your mask and social distance and sanitize after you get the vaccination. So the question is whether or not you should continue to do those things. And we'll start with you, Dr. Floyd. You're muted.
Okay, I'm unmuted now. Can you hear me?
Yes.
Great. So most definitely you should continue to wear masks, continue to sanitize your hands, because you also want to protect other people. You may have gotten the immunization, but someone else may not have had the immunization yet. It does not mean that you can't carry things on your hands or do other things that could potentially affect other people, your loved ones, people close to you. The other thing, coming from where I come from as a primary care physician, and we try to catch all things at the root, is that if you have a condition, pre-existing condition, such as diabetes, such as other things that depress your immune system, then take all efforts to make sure that those things are under control. If you have diabetes and your sugars are high, they're 300, they're 200, then you need to get with your primary care physician. It's time to get it under control, because the more out of control that particular disease process is, the more immunocompromised you're going to be. So it's not just about, the face mask and the hand sanitizer. Those are very important. But if you have other diseases that make you, more susceptible, and you know this, and even if you don't have any of these diseases, do things to take care of yourself. Use your common sense in terms of trying to social distance. You should still try to social distance. You should still try to do all these things. But more importantly, don't forget to take care of yourself in general, because those things will help to keep you healthy as well. Because there's other things out here, the flu, the common cold, all those things, if you catch them, it depresses your immune system and puts you at risk for catching COVID. So do your best to take care of yourself and do all the same things that you did when or before you got the vaccination.
Thank you.
So one question that has come through, we know that currently there are two vaccines that are available, the one from Pfizer and the other one from Moderna. One of the questions that's come through is, how is the Johnson & Johnson vaccine differ? How does that differ from the other two vaccines that are currently available?
You want me to tackle that one?
Go ahead.
Okay, so the first two vaccines that have been approved, the Pfizer and the Moderna vaccines, are messenger RNA vaccines, and the Johnson & Johnson uses an adenovirus, or a common virus that people get to introduce the spike protein into the body. So it's a different method. And the nice thing about the Johnson & Johnson vaccine, looks like it's going to be just one shot needed. So it's going to be exciting to have multiple vaccines out on the market, but it is an adenovirus vector. So it uses a virus that won't make you sick to introduce the ability for your body to make antibodies against COVID.
And I would add that this is the same technology used for the flu shot. So Johnson & Johnson is using known technology.
So this
I
is
guess
a
the other good thing
question
about
that,
it is that.
oh, sorry, go ahead,
I
James.
was just saying, the other good thing about it is that those could be stored for longer periods of time, and they can be stored easier as opposed to the Pfizer ones that need to be in sub-zero temperatures and so on. So.
Thank you.
Thank you, Dr. Prempeh. This is a question that I'd like for all of the panelists, if you will, and I can call your names at the time to answer. But it says, what impact has COVID-19 had in patients that you take care of? Starting with Dr. Edwards.
I would say in our pregnant population here in Carrollton, we've actually been pretty fortunate that we haven't had many severe cases. I think we've only had one or two that had to be transferred out for higher levels of care. I know, like in the offices, of course, we were limiting the number of people that were coming in the offices, and also even like, when patients are in labor, even though I know it's very uncomfortable for the patient when they're going through the labor process, still having the patient and that family member still continuing to social distance and wear face coverings. And so fortunately, a lot of the cases that we have come about in the OB and the GYN world have been like incidental findings with our universal testing. So a lot of them have fortunately been asymptomatic. So we're definitely thankful for that in this area. But definitely in some other cities, other hospitals, there have been, lots of pregnant patients who've had to be intubated and deciding like, when is the right time to deliver baby and everything. But thank goodness we've been, knock on wood, don't want to speak it up, but thank goodness we've been pretty okay here in Carrollton.
Dr. Floyd.
What I've seen in terms of COVID, as I told you before, I'm inpatient and outpatient as a family physician. So we've seen a lot of things, and these things are, I have some good stories. I have my very first COVID patient had bilateral pneumonia and was over the age of 73. He got better, but I've had numerous patients, same age group, who have not gotten better and have passed away. I have had patients who are actually have family members as a patient who are nurses, who are working our facility. And I've seen them get better, and I've seen this virus trick us as we give them everything we can throw at the patient. and they get better, and then they decline, and they pass away. Um, so it's a wide and varying degree of things that happen. We've had several patients in their 40s to pass away from COVID, but we've had a number of cases, well, a large number of cases where people do get better. People have to be out of work. There are cases where we've had some complications after COVID where people have developed blood clots and now they're on blood thinners. So COVID is not just about you get the disease, you get infected, and then you worry. You do, because what is going to be my process? Am I going to have to go to the hospital? Am I going to have to be on oxygen? Am I going to have to be intubated? What is going to happen for me, which is a very distressing thing for. I'll go ahead and pass along.
All right. Dr. Jerome, the question is, what impact has COVID-19 had in the patients that you take care of?
I would say the major change has occurred on call. Normally, we're doing operating room cases that are emergencies or replacing epidurals on our labor and delivery unit. But on call, we're called to put breathing tubes in patients that COVID's been around for a year now. I know that they're not going to make it. Another difference is that the last face that they see is mine, and I'm wearing a mask, and I probably look like an alien to them. It's very disheartening that there's no one in the room with them. We're used to when we go to the ICU, the entire family's there. It's a little bit more relaxed. They're nervous about getting the breathing tube. But now I come in, I can see the fear in the patient's eyes. And a lot of times I'm calling their loved one to tell them what we're about to do. So it's made me, I would say, a lot more empathetic. I typically cry as I intubate those patients because I know that I'm the last mask face that they're going to see. So no more birthdays, no more anniversaries, and they're essentially there, unfortunately, alone.
Thank you. Dr. Glass?
Well, as I said previously, I work primarily out of the psychiatric facility. We see emergency psychiatric patients who are suicidal or homicidal, that sort of thing. And I might relate that when this first started, when COVID first hit the scene, there was whisper in the community that you should stay away from the hospital. That, if you go to the hospital, you're going to get COVID. So we saw a drop in our number of patients that were being admitted because I think they were just scared to go to the hospital for anything, much less a psychiatric diagnosis that would get them admitted to a psych ward. So over time, what I came to realize is that a lot of these patients started to decompensate because they weren't seeing their regular physician, nor were they seeing us in an emergency situation. So they weren't getting their medications. So you have schizophrenics that were uncontrolled, depressed patients without their antidepressants. And you can imagine that the natural order of things would be that they would decompensate, and that's what happened. So going forward, after that short stint of not seeing patients, we started to see a lot of acute decompensated suicidal patients. And of course, we don't see the ones that are successful in their suicides because they go to the morgue, they don't come to us. So my perspective is one that, the psychiatric aspect of this disease has really done a number on people. And even in those who don't end up in the psychiatric facilities, because depression and anxiety and schizophrenia are widespread throughout society, and we just don't pay as much attention to it because, you know, people aren't under the stress, but now the stress is taking its toll. So, yeah, that's my perspective.
And Dr. Howard?
I would just add on to what Dr. Jerome said. You know, I'm an anesthesiologist as well. I would say though, it's not just on call that we go to the ICU. So we're working our regular day. We're trying to have this close, intense relationship with our patients as we're trying to prepare them and reassure them before they have their elective surgery. They don't know though that 10 minutes before I walked in to see them, I was just putting a breathing tube in somebody who may be dying of COVID, right? And I'm coming down to you and I'm trying to discuss with you why you have to put your mask on when we go through the halls in the hospital. And sometimes it's a fight and it's very draining. There's an added layer of anxiety because we are seeing COVID every day. I'm trying to keep my patients safe. I'm trying to keep my coworkers safe. And then you have to go home and try to keep your family safe. And I don't think, I mean, it's been a long time that we've been dealing with this, right? We're doing things that we don't normally do. We're on an extended use program of these masks and these gowns. It's just at a different level than we're normally used to. And it's a lot. And I think we're all a little tired. We're all a little drained. We're still moving forward. We're still giving good care, but it's a lot. It's a lot to turn on the mask and I'm here for you. I'm going to keep you safe and I'm going to do that. But in the back of my mind, I just saw somebody who's almost dying, right? And 10 minutes later, I'm going to see another person who's almost dying. But let's keep you safe and I'm going to encourage you, but it's a lot. It's just a lot.
Thank you. Dr. Lucas?
So I guess with me, it's just very busy. So we're seeing a lot of patients. I'm a gastroenterologist, so we're seeing a lot of patients that are bleeding. With COVID, patients can develop clots in the legs, blood clots in the lungs, and so these patients are placed on blood thinners. And so then they start to bleed. So we're seeing a lot of patients that are bleeding and some, unfortunately, that are just bleeding out, bleeding to death. And so you're having to make decisions between, does this patient stay on their blood thinner because they've got pulmonary embolism, they've got blood clots in the lungs, versus stopping the blood thinners because they won't stop bleeding from, whatever lesion. Called on to put a lot of feeding tubes in. So these patients that do not die, that are in the intensive care unit, that are intubated for a prolonged period of time, after about 2 weeks, generally those patients will undergo a tracheostomy as well as a PEG tube or feeding tube. There was 1 week that we had put in so many feeding tubes that we actually ran out of tubes. Like, we didn't have any feeding tubes. This is the only time I ever remember this in the history of being here. We had no feeding tubes, not at Carrollton, Villa Rica, Higgins, none. We had to be restocked by our suppliers because we had put in so many feeding tubes that 1 week in patients that have COVID, that are lingering, that are in the ICU, that can't eat, that can't swallow. So that's been a change for our practice.
And Dr. Pham, the question is, what impact has COVID-19 had in patients you take care of?
Well, my patient population is definitely high risk, older, younger. As a rheumatologist with these autoimmune diseases, you, even without medications, theoretically, you are at a higher risk for any type of infection, with or without. What I dealt with initially was anxiety, especially when COVID was so new, before the testing was available. The main question was, what do I do with my medications? Do I stop? Do I decrease the dose? Do I change it into intermittent dosing? And it caused a lot of anxiety with my patients, to the point where some would hold the medication, and then we ended up dealing with a lot of flares. And with that comes additional doses of immunosuppression to get them back to where they were before, specifically steroids. And at that time, there was a lot of anxiety for me, because my concern was, if we treat you with higher immunosuppressive therapy because you're taking away your own medicines, are we ultimately putting you at a higher risk with you being off. And so with time and with this counseling and discussions and expert consensus through our American College of Rheumatology, we've been more confident with continuation of medication. So since then, I've been able to provide more counseling for my patients to continue their medications. And I'm very fortunate because my patient population, they already know they're at high risk. So they've been, for the most part, very hypervigilant in being safe, wearing their mask, sheltering at home, being wary of family get-togethers, large groups. So for the most part, because of this compliance and because there's so much fear that because they're in a higher risk group, I haven't had as many severe cases as I initially had thought, and very blessed with that. And also what I've noticed, which is interesting, is those who continue their medication steadily and even with up titration throughout these several months with COVID, those who've had contracted COVID have not been as severely sick as I had anticipated. And that is also something that my colleagues have experienced as well. So I would say more anxiety at the beginning, but now there's a little bit more confidence, especially with more time and experience. And I'm also very grateful that many of my patients have come to me and asked me, where can they get the vaccine? How can they get that? And so I don't feel like I have to reach out and tell them specifically because they're the ones who are ready to receive it. And I'm here to guide them and compliment them and take questions.
So Dr. Prempeh, the question again is COVID-19, how's it impacted your patients that you take care of?
Well, I guess several ways, but the main issue, I guess, would be more of anxiety from the patient standpoint, just the fear of progressing, in the illness, given everything they've seen or heard on TV or from family. They come in with pneumonia, but then they have other consequent systems involved, be it their heart or if they wind up getting clots and so on. So, and also the fact that they don't have family in the rooms, obviously because of the pandemic, a hospital has rules where you can't have, various family members in there to prevent spread. So here they are stuck in a room. Some of these rooms don't have windows because they were kind of makeshift rooms. So kind of like a jail, you're in four walls, all you have is a door and just sit and stare, watch the TV. So you have that problem. The other issue too is just the sheer numbers. We have so many patients that we can't spend as much time with every patient as we usually would be used to. Patients realize that, we as providers realize that, they don't like that. And I mean, it's gotten so bad that, as some of us know, we actually have a tent in our parking lot because there's no room in the hospital. We are so full. I never thought I'd see this here. So that the other issue too with volumes is, actually I have an example. There's one time I was taking care of a patient whose oxygen level was getting to the point where we had to step up the pressure of oxygen that we're giving her. So we had to use what we call a BiPAP machine. And the nurse was standing next to me. I was in the room with the patient's daughter. And I told the nurse that, well, we need to put this lady on this higher mode of oxygenation. And the nurse sort of whispered, but the daughter heard that, well, Dr. Prempeh, we are out of BiPAP machines. We both took a double take, and the daughter actually asked me whether she could go out and buy one, which obviously she can't. But that, I guess, just the impact of how these numbers have affected everything, things that I never thought we'd run out of, just like Dr. Lucas was talking about them running out of feeding tubes. So it's been a lot. It's more than the disease. It's micro and it's macro. So pretty significant.
Dr. Spraggins?
I'm one of the staff anesthesiologists, and sadly, my experiences have been the polar opposite of what Dr. Phams have. By the time we are involved, oftentimes a patient is no longer able to oxygenate at all on BiPAP, certainly not on their own. And again, we are often the last person that that patient will see or remember. And it's been hard. It's difficult to go from intubating people to very probably saving their lives and knowing, well, okay, just they're going through something and in a couple of days we'll wean them off the ventilator, to intubating someone knowing this is the very last resort and it's probably going to be unsuccessful. So it's been a long 11 months. And I wish the hypervigilance of Dr. Pham's patients extrapolated out to the rest of the country and the world, because we would have seen some terribleness, but I think it would have been far fewer people with the symptoms and the deaths that we've seen.
Thank you. And finally, Dr. Larson.
It's just been overwhelming. For me, as an infectious diseases doctor, usually I can tell a person with a certain infection what to expect. And I can predict based on information if you're going to do well or not. And that's not COVID. COVID is still unpredictable. A year later, we cannot predict with certainty who's going to make it, who's not. And every time I go off the hospital call, I go back and look at the list, because people that I thought were going to do fine didn't do fine. We've had husband and wives come in and die. I've never had a year where so many people died of the same infection. It's just been overwhelming. We're very tired. It's been very, very hard. But it's, you know, the unpredictability of it is what produced the most anxiety for me, because, you know, things like, you know, I had a 53-year-old on the ventilator for 80 days. Patients usually go on the ventilator, a lot of them survive. And at one point, over 90% of the patients that went on the ventilator were dying. So that it's been overwhelming to take care of people and to know what the anesthesiologists are talking about. For most of the time, if you get to that point of being on the ventilator, you may not survive.
Thank you. And back to you, Dr. Lucas.
So I have a question that has come up. We have a lot of nurses and a lot of people that are childbearing age that I've talked with personally that say they want to wait. They're not sure about getting the vaccine because, you know, they're thinking about getting pregnant. So the question is, should I take the vaccine if I want to get pregnant, or if I am pregnant or breastfeeding? Should I take the vaccine? So we're going to give this one to Dr. Edwards, please.
Yes. Our college is saying that at this point, you should still take the vaccine, especially if you're in that high-risk population. So those patients who are, you know, frontline workers, healthcare workers, you know, teachers. Of course, the studies did not include pregnant patients, but there were a handful of patients who did get pregnant during the study. And of course, you know, this is within the last couple of months, last 6 months or so, but up to this point, there haven't been any adverse effects that are any different from the patients who were not pregnant. And so at this point, because it's not a live virus, it is an mRNA virus, ACOG is saying that we should not hold the vaccine from pregnant patients, breastfeeding patients, and that if they so choose, that they should be able to get the vaccine, and that, you know, a pregnancy test isn't required to get the vaccine. So all in all, of course, we can't say that there's not going to be any effects in the future. Of course, we can't predict the future, no, but from the information that we have right now, it is recommended that we not withhold the vaccine from pregnant and lactating patients.
Thank you.
Can I just add, and maybe Dr. Edwards and Dr. Larson can circle back on this point. Some women have asked me, they were concerned that there was an issue with fertility or infertility with the vaccine. And from what I've read, and again, Dr. Larson, Dr. Edwards, please let me know, there was a question that there's a protein or suspected protein in the vaccine that might be similar to a protein that's in the human placenta. And from my reading, that is not true. It's not similar at all, or not enough so that your antibodies from the vaccine would attack the human placenta. And then I saw an advisory from Pfizer where they said they don't even have that protein included in their vaccine. So I think there had been some theories or some rumors that, oh, if I take the vaccine, it's going to cause infertility. And that has not been found to be true.
And I think it's important to add that there's no fetal tissue in the vaccines. These are made in a lab. There's no beef products and pork products for people that have alpha-gal, which is the tick-induced allergy. And Dr. Pham, one thing that I have a lot of people ask me is, when you have autoimmune diseases, should you get the vaccine? And I hope that's okay from the moderators that ask that, because that's, a big question I get all the time.
So with all vaccines, actually, there has not been trials specifically just with the autoimmune patients on immunomodulatory medications. The same thing arose with the Shingrix vaccine. And when that came out and that was new, there was a lot of concern that because it's so potent and it drives up your immune system to make antibodies, will that theoretically increase your risk of flares, or maybe introduce you to the possibility of new autoimmune diseases? And we haven't seen that with the Shingrix. And so what we're doing as a society with our American College of Rheumatology is we're extrapolating our experience with the Shingrix vaccine. And granted, it's not an mRNA vaccine, but it still has a very robust response. So we do not, with my limited experience now with those of my patients who have been fortunate to get the vaccine, I have not seen any flares. And I'm waiting for that phone call, but I've yet to hear it. And talking with my colleagues as well prior to this Zoom conference, their experience is the same. So with all that, I am very supportive of the vaccine whenever anyone comes and asks me for it.
So there's a question that says the patient is a 63-year-old who had a two-time heart attack survivor. Her husband is her caregiver, and because of a chronic condition, can someone help her get the vaccine? I think what this question is asking, where are we with the tiers in terms of vaccination itself? Laura.
Dr. Larson.
Sure. We have to follow the tiers that the Georgia Department of Public Health has established. And we don't know when the next tier will open up, but currently only 65 years and older, and those in the healthcare field, and then caregivers of people over the age of 65, of persons over the age of 65. The Department of Public Health's website has the tiers, on there, so you can see exactly who's included. But we will not know when we're moving to the next tier until the governor and Dr. Kathleen Toomey announce it. And then if we vaccinate people outside of those tiers, the Department of Public Health can come in and revoke vaccine. And in one hospital system, medical system in Georgia, the vaccine has been revoked from them for 6 months. So we really have to follow those tiers in order to keep getting vaccine.
Dr. Lucas.
All right, so we're saying get the vaccine, everybody get the vaccine. So one question that's out there is, who should not get the vaccine? What patients or what population should not get the vaccine?
Really,
And
anyone
it might be good to,
yeah.
go ahead.
Anybody that has any allergies to the components of the vaccine, polyethylene glycol is in the vaccine, and that's a very rare allergy, but some people may have allergy to that. But there's no specific person that shouldn't get it, except for people that may have allergies to the components of the vaccine.
Although if you're actively, if you're recently became positive with COVID, you need to be delayed for, where are we at, 30 days now, if it's a mild case?
Yeah, yeah. And, you know, the CDC still recommends 90 days just so other people can get it, because if you've had COVID, we're just not seeing reinfection in the first 90 days. And so, but you can get it earlier than 90 days if you've had a mild COVID infection.
There's
So
a
another question that has come.
Go ahead.
Oh,
Please.
go ahead.
No, you go ahead, please. Go ahead.
No. All right, so there's a question about, is there a process in place for elderly patients to get the vaccine if they don't have internet access? How are these patients to navigate the system and get vaccinated?
I think there have been a lot of ways we've been trying to address this. Number one, if you don't have internet access, potentially ask someone to help with that. You can, the Department of Public Health vaccine telephone line opens and closes depending on when they have vaccines. So that's very frustrating. But I think it's the best that they can do. And then you can go to the hospital's website to sign up for interest in the vaccine. And we're opening more vaccine clinics up as we get vaccine as well. And then go to the Department of Public Health. Well, I mean, this is assuming people have internet though. But it, you know, talk to your doctor. Some of us have, you know, people have come to me and said, hey, how can I do this? And I know a lot of doctors' offices have been helping their patients navigate that, getting vaccine or getting signed up.
If I'm not mistaken, last week, Mr. Stocks gave 1 or 2 numbers for people to call so that the folks at the NAACP could assist them. I assume those numbers are still valid. We just would need to get him to give them to the folks on the panel.
We can put those into the chat, or we can do that live right now. For more information, the NAACP can be contacted at 770-877-2991. I'll repeat that one more time, 770-877-2991, or we can be reached via email at Carroll County NAACP 5179@gmail.com. And again, we have a Facebook page, our Carroll County NAACP Facebook page. There's information available there as well.
And I would add that Tanner has been gracious enough to allow us to reach out to the churches in the community. So you can always go to that point of contact, the pastor, the secretary, and they will have a means to assist you either via the internet, or they could give you the phone number that is on, I can look it up and put in the chat, the Tanner website as well.
Thank you, Dr. Jerome, for that.
And I'll just add to just lean on your younger, you know, if you are not internet savvy or don't have internet, just, you know, utilize your children, your grandchildren, because they're going to very likely have a cell phone and may be able to get you signed up on a list through the internet, because it is very frustrating if you're calling the phone number and it's busy and you're calling, you can't get an answer. It's very frustrating. But almost everybody knows somebody who's younger, and that younger person is going to have a cell phone, even if they don't have a computer, and can help you in that way. So just, you know, let's utilize all of those resources.
Can I echo that?
Yes.
So speaking to the internet and not having access to these things, you know, as a primary care physician, you know, I always get down to the nitty gritty. Think of it as that present that child is looking for that no store has. Okay, that's how you need to pursue it. You call everybody you know. If you call all the hotlines can't get through, call somebody to know somebody to help you get the vaccination if you're really trying to get it. Go and see your primary care doctor. If you ain't seen me in 5 years, come see me anyway. I will do what I can do to try to help you get this vaccination. Somebody knows somebody. So, as we have do in the past, everybody didn't always have a phone, but somehow we found ways to get around things. So don't use I don't have the internet as a reason why you're not trying. Reach out to your pastors because we're reaching out to the churches, we're reaching out to the community. Call Publix, call Kroger. Everybody that you see on the news say they're going to have the vaccine. At least try, because it'll be out there, and we just have to be patient and then stay safe in the process of waiting. Keep doing what you're supposed to be doing, and stay safe.
Thank you. I believe I'm correct in saying this, that all of the panelists have had the vaccination. There's a question that's in the chat room that says, what side effects occurred? So I'd like maybe each one of the panelists, if you will, very briefly discuss any side effects or issues that you may have had or heard of regarding the vaccination itself, starting with you, Dr. Edwards.
So with the first vaccine, I just had injection site soreness. My arm was pretty sore probably for 2 days, but not bad enough for me to want to take the Tylenol or Motrin. And then I would say probably 48 hours, then it was just kind of tender to the touch. The second one, I switched arms for the second one, and I put it in my dominant arm because, maybe if I used it a little bit more, it wouldn't be as sore. So it wasn't as sore. I would say probably about, and this is neither here nor there, about 4 hours into it, I just felt really sluggish, but I had also eaten bacon cheese fries from Wendy's. So vaccine or Wendy's, not sure. Probably the Wendy's, but I was surprised.
Dr. Floyd.
Yes, I've got the vaccination. I've had both doses. The only side effect I had was soreness. I got it in my non-dominant arm, in the shoulder, at the injection site. Same soreness I experienced with the flu vaccination. Same soreness I experienced with the tetanus vaccination. I did not have any other symptoms. But I have, we've had patients that have some mild symptoms. We've had some patients have low-grade fever. We've had some patients that had some nausea. I talked to one gentleman that works for the health department, and the biggest thing that they've seen was a panic attack, which is just due to the anxiety of, all of this is going on and taking the vaccination. So, but there are some side effects that potentially can happen, but I've seen nothing that is life-threatening. I've seen nothing that would make me feel like I wouldn't suggest anyone get a vaccination.
Dr. Jerome.
So I ran to get both shots. I've had no side effects. My 78 and 73-year-old parents have both received the vaccination, and again, no side effects at all.
Okay. Dr. Glass.
So I had the first injection some weeks ago. I've had both injections. The first one, typical, had the arm soreness that everybody talks about for about 2 days. Nothing to take Tylenol for or anything like that. The second injection, though, I did get some side effects. I had a headache the next day. I felt like I had a fever, but I kept taking my temperature. It was normal. I had some chills, some minor joint aches and that sort of thing. Someone had suggested, the nurse that gave me the second injection told me that I should go ahead and take some Tylenol. That way I wouldn't have any symptoms, but I'd rather feel the symptoms and know that I actually had something, then to take the Tylenol and then wonder, "Oh, did they give me water in there?" So I waited and let the symptoms come. Um, that was the first day. That night, on the second night afterwards, I felt like I broke a fever almost, because I woke up in a little bit of a sweat. But again, nothing spectacular. I did take a Tylenol that night, and when I woke up in the middle of the night, I was feeling like, wow, I should go cut the grass or climb a tree or something. I had all this energy, and uh, I hit the ground running the next morning. I was feeling great. So I don't know if that was just a relief of, oh, I got through both vaccines, or I actually, got over some minor side effects. But since then, I've been right as rain, no problems. And by the way, my dad just had his second injection 2 days ago. He's 81. I should know that. But he said he had no side effects from the second injection, except he said he mentioned some itching. He said he got a little itchy from time to time. That's the only thing that he's noticed so far. So,
Dr. Howard?
I have received both vaccines. I also get allergy shots once a month, and my allergy shots hurt and they leave a lump on my shoulder. The vaccine did not do that, did not do anything at all. I was perfectly fine. I have encouraged my 98-year-old grandmother to get the vaccine. Her first injection caused no pain at all. She did say after her second, her arm was sore for about half a day. And both my parents have received them. And aside from just some sore arm, no one else has had any issues, and nothing that lasted longer than one day.
Thank you. Dr. Lucas?
So I have gotten both. The first injection, I thought I escaped because I felt great. That first night, I woke up the next morning, I had a severe headache, like a sinus headache, but really, really bad. And my arm hurt, and I just kept working. And after a few hours, I was like, why don't you take something? So I took some Tylenol, but I was pretty miserable the first day. The second injection, I took Tylenol as soon as I got home. And the next day just had a very mild headache, very mild shoulder pain after the second one. There were some people in our practice that took the vaccine, and there were several people that complained of hip pain and flu-like symptoms after receiving the vaccine. So, but again, the symptoms tended to last just for one day, several hours, and gone by the next day.
So Dr. Pham, same question, but along that line, is it okay to take Tylenol or Motrin or those kind of things before or after you have the vaccine? So tell us about your side effects, if any, and then is it okay to take Tylenol or ibuprofen or Motrin or NSAIDs before or after?
So I had the Pfizer shot. The first shot felt like easier than this year's flu. The second shot, I had soreness in my deltoid in my right arm, my dominant arm. I should have switched to the non-dominant. I did experience a little bit of a headache. And about the week after, I did experience thigh fatigue. And that was on a hard 10-mile run. So that lingered for about a week, and then it went away. And since then, it's been fine. With my patients, the ones who have been fortunate to get it, the most common side effect was didn't feel anything. They weren't sure if they got the vaccine, which I was impressed with. Injection site soreness, but not as much joint pain as I had anticipated. Maybe flu-like symptoms where they ache a little bit with the headache. My nurse practitioner had a stuffiness after her first injection about 2 weeks after, and then the same symptoms with the second injection 2 weeks after. And she actually had a fever that broke within 24 hours, and it felt fine since. In regards to Tylenol and ibuprofen, I've been recommending for my patients that If they're known to have a little bit of a reaction or any type of reaction to any type of vaccine, to go ahead and use Tylenol. I prefer Tylenol just because a lot of my patients have taken a lot of NSAIDs and they've had side effects from it, whether it's in their liver or their kidneys or blood pressure. And with the second injection, if they had a bad reaction and their blood work is okay, meaning that they don't have chronic kidney problems or liver problems, then I tell them to pre-medicate before or after with an NSAID like ibuprofen. But my preference has been Tylenol, and the ones who've taken it have been doing really well. And again, I have not seen a flare in their autoimmune disease, not significant joint pain, more, if anything, flu-like symptoms and a sore arm.
Thank you. And Dr. Prempeh?
So I had the Pfizer injections, both on my non-dominant arm. With the first injection, I had muscle soreness for about 24 hours. Didn't take anything for it, and just went away spontaneously. With the second one, I did take some Tylenol before the second injection. I had very mild soreness, which lasted maybe 3 or 4 hours and went away. Didn't have any flu-like symptoms otherwise, no fevers, no fatigue, no significant illness at all. So.
Dr. Spraggins?
I had the injection, both days were pre-call days. So I had it in my dominant arm because I needed my strength for my non-dominant arm for intubating. And I had no symptoms other than about 24 hours post with the first vaccine. I had some point tenderness. Other than that, no issues. And with the second vaccine, I got it on a Tuesday. I remember that. And I was a little tired, but not unlike Dr. Edwards. It might have been because I was up watching the national championship on Monday night and up watching Sunday night football on Sunday. So I think I had no side effects to speak of. And certainly none that would come close to what I see with the patients that we take care of.
And Dr. Larson?
Yeah, I got my COVID vaccines in September as part of a clinical trial that I enrolled in. And so I'm 5 months out. So I haven't had any long-term effects. First shot, I just had a lot of pain in my shoulder. Second shot, I had a little swelling in my armpit and a fever, but I would not have thought I was having a fever. It felt like a hot flush, and I'm 50, so there we go. I think it's important to know that we've given over 9,000 vaccines at the hospital. We've had no cases of anaphylaxis, and we've only had a couple of patients that we gave some Benadryl to that developed itching. So we've had, that's really good to know that. And I really appreciate some people. Dr. Duran volunteered to give shots, and so that was neat to see her in there. And that's been very fulfilling to do. It feels like you're really helping the community.
And Dr. Larson, what type of vaccination, which vaccination did you get?
I got the Moderna vaccine. And next Tuesday, both of my daughters are enrolled in the Moderna adolescent trial. So they will get either the vaccine or placebo. They're studying 1,000 children. Pfizer's studying almost 3,000 children. So I feel so strongly that I'm enrolling my children as well. And my husband's been vaccinated. He got the Pfizer vaccine as working at the hospital too.
And I would add that I have anaphylaxis. So there's the myth that if you carry an EpiPen, which I've carried for quite a number of years, I'm allergic to pistachios. And I had some inadvertently and wound up going to the ER, spending the night in the ICU, was on an epinephrine drip, etc. And I received the vaccine and had absolutely zero issues.
Dr. Lucas?
Good to know. All right, so our next question has to do with COVID and heart disease. So one patient asked, they've had COVID, and how can they tell if they're going to have heart problems in the future? Because occasionally they get chest pain. So of course, Dr. Rouse, I want you to jump in and tell us about COVID heart and what to expect after you've had COVID-19 in regards to your heart.
So it's very interesting. First of all, a lot of these symptoms that people have with COVID can be symptoms of heart disease as well. We are seeing a tremendous number of people have something called post-COVID syndrome or long haulers. And this past 2 weeks, I think it was, I've seen about 6 or 7 of these individuals in my office. They're usually people that have had COVID, gotten over it somewhat, and anywhere from 2 to 4 months prior is when they develop these sort of symptoms. But they have this chest pain and chest tightness, shortness of breath. They seem to have a lot of elevations in the heart rate, and something called orthostatic hypotension. When they go from a sitting position to a standing position, for instance, they get dizzy because the blood pressure drops down. What I do with people that have these kinds of symptoms, I treat them no differently than anybody else that comes in my office with those kinds of symptoms. I do an evaluation to determine if there's any cardiovascular issues going on. For instance, we may do an EKG, we may do a stress test, we may do a number of ultrasound of the heart, other kinds of things to try to make a determination whether or not there's a problem there or not. A lot of patients, a lot of cardiovascular issues that people develop as a consequence of COVID exposure. And those cardiovascular issues can be anywhere from inflammation of the sac around the heart called pericarditis. The muscle of the heart can become inflamed called myocarditis. You can have congestive heart failure, you can have rhythm disturbances, you can have some of these clotting disorders that people talked about earlier. You can have what they call an acute myocardial infarction. But most of those kinds of situations, those ominous, if you will, are really troublesome situations occur while people are in the hospital. Outside of the hospital, I do the typical evaluation that I do for other patients that have these symptoms.
Thank you. I think you have the next question.
Yes, I do. There's a question that says, and I don't know if any of the panelists will be able to answer this or not. It says, can my pets carry the virus? And if someone has the virus, should they isolate themselves from their pet? It's a good question.
It's a really good question. We know that pets can get COVID. The first case of an animal getting COVID in the United States, I think, was a tiger up in a zoo. And it looks like the animals do pretty well with it, and cats seem to be getting it more easily than dogs. But yes, you should isolate yourself from your animal. We don't know for sure. Well, we know that it's transmitted, especially with the zookeeper situation, human to animal. I don't know that they have ever found for sure that it can go animal to human, but yeah, animals have gotten COVID. It's strange.
Well, along that same line, Laura, where did this virus allegedly originate? Do we know? What is the latest thought in that regard?
So the feeling currently, and still has really been the same, is that the origin is a bat virus. And there are scientists that study this group of bats in China that apparently carries a lot of coronavirus. And they feel like there was an intermediate vector that the bat somehow infected an animal that subsequently infected a human, is how we think it happened, just based on they've sequenced the virus and they can tell that it was predominantly bat in origin. What it hopped to and then hopped to us, we don't really know.
In the movie Contagion, it went to a pig and then to humans. And along the line with the pets, I've had a young patient in his 20s that had COVID, had a lot of upper respiratory symptoms, fever, all of that, got completely better, has a dog. And then after getting better, a couple weeks later, he noticed that the dog was kind of sluggish. And then he came down with all of these symptoms all over again. So I really do believe, I mean, obviously no way to test that, but I do believe that he had it, gave it to his dog, he got better, and then maybe got reinfected, but he started, like he felt great, went back to work, and then started having these symptoms all over again, and just noticed that dog like wasn't eating and, just wasn't as playful as usual. So I think that it definitely happens. So One other question was about people that have high blood pressure. And I think that sort of dovetails into what you've talked about with heart disease. But if you have high blood pressure, how can the virus affect you? Maybe one of the internists can jump in there.
I mean, I think, so, you know, according to the CDC and NAACP, high blood pressure, hypertension is among the risk factors that lead you to have, you know, more severe disease like heart disease, diabetes, kidney disease, and so on. So I think it's more part of the spectrum where if you do have high blood pressure or some of these other issues, obesity, even advanced age, lung disease, and so on, you do have a higher chance of getting moderately to severely sick. I don't think that high blood pressure in itself is special compared to some of the other issues. Basically, if you have any of these risk factors, you do have a higher chance of getting sicker with it. So.
I can also maybe speak to that. And I agree with Dr. Prempe in that hypertension in itself probably it's not going to put you at necessarily a greater risk. But if you have hypertension and you take your medicine on Monday and then maybe again on Friday, and it's been this way for 5 years and your blood pressure is uncontrolled, not only do you have hypertension, you potentially are developing other disease processes that if you do get COVID, you are more likely to have more complications. So like I said earlier, in terms of addressing COVID and preparing ourselves for COVID and preventing the disease process, you know, we need to make sure that we're taking care of these other things that happen. I have high blood pressure, you know. As doctors, we're not bulletproof. I take blood pressure medicine and I do my best to take it every day. I might miss maybe one day here and there, but other than that, I'm compliant. So you got to do your best to be compliant, make sure your blood pressure is under control. If you're not sure if your blood pressure is under control, go have it checked. If you've been taking the same medicine for 10 years, but you still haven't seen a doctor, and somehow you keep getting refills, go see your doctor and, you know, get these things checked out. Find out what's going on with your body and make sure that you can stay as healthy as possible. But in terms of blood pressure, yes, just make sure your blood pressure is controlled, because if it's not controlled and you take over-the-counter medications, then that can lead to other complications as well.
Can I just say a word or two? There's been a number of series or research that studies that have been done looking at these issues relative to comorbid conditions, and the people that do poorest in terms of being hospitalized and in terms of dying have these comorbid conditions. And you've heard these comorbid conditions Dr. Prempe so eloquently elucidated: high blood pressure, diabetes, cholesterol, and etc. In one of the series that I reviewed, if you were hospitalized and you had COVID and you were had a stroke or a heart attack, you had about a 55% chance of dying during that hospitalization. Tremendous number. And these people, a number of these people that had strokes and heart attacks obviously had a lot of these underlying comorbid conditions that we're talking about. I guess my question, there's a question about whether or not these vaccines be able to protect us against the new variants.
So far, yes. Both with the Pfizer and the Moderna are protective against the UK variant and the South African. That is not necessarily the case. I think in South Africa, the AstraZeneca has not been as protective against the variant. But for right now, you know, the goal would be to vaccinate as many people as we can to try to, you know, get protection before variants become even more mutated. So that would be our goal.
Laura, can you define what you mean by variant?
So there has been a lot of talk.
I just asked her to define variant. I'm sorry. Would you define variant?
Yeah, it's just, it's not the original wild type virus. And wild type is just essentially what they call the original form of the virus. But the virus can mutate and change a little bit, and they call that a variant because it varies from the original virus. And these vaccines are made against the spike protein of the virus, and if that virus varies itself enough or mutates enough to where that spike protein is not the same, the vaccine could not be protective. So that's what it means.
All right. So one of the questions from last time, which I think would be a good question to kind of end with as our time is coming to a close in just a few minutes. One of the questions from last time was, what are the risks of not getting the vaccine? So there are currently more people that want the vaccine than we have vaccine currently available, which is good, but there are a lot of people out there that are still vaccine hesitant. A lot of people are hesitant about getting the vaccine. They still have a lot of questions. And so if we could just go around kind of quickly and say, like, what are the risks of not getting the vaccine? Anybody?
Well, I mean, sorry, go ahead, Dr. Last.
Well, I would say the most obvious risk is that you could come down with COVID and end up in the hospital on one of these events like my colleagues have been talking about. The problem is, when you look at the efficacy of the vaccines and you say, oh, well, it's not 100% protective. Well, it's 95% protective against getting the virus. And as Dr. Larson had said earlier, it's 100% protective against severe disease. So even if you got it after getting the vaccine, you're less likely to land in the hospital. The other downside is that if you actually contract COVID in the wild, the risk of complications is a lot higher. You're going to run the risk of having ongoing lung disease. There's this chronic fatigue syndrome that has stricken some patients. Dr. Rouse mentioned COVID heart. There's all these and blood clots that are debilitating. A lot of these people are walking out of the hospital, but they're not walking out very well. And, my suspicion is that we're going to have a long list of disabilities that we're going to be treating for the next 10, 20, 30 years related to people who actually came down with the infection and had some pretty bad side effects, although they survived.
Again, to reiterate, you don't want me to be the last person that you see. Getting COVID can be terrible. And from what we have seen so far, the vaccine is, as of right now, our only way out. And it dawned on me that we didn't mention that a fair amount of patients have been leaving the hospital and now they're on dialysis but I think Dr. Quello usually brings that up. So that's one of the long-term ill effects of getting COVID. I mean, even if you do survive, but considering you don't know whether you will survive or not, the vaccine is a way to ensure your health and also help with achieving herd immunity and helping us get back to normal, us being everyone.
So we got maybe about 10 minutes left, and I'd like to give each one of the panelists the opportunity to speak. So in 30 seconds or less, what do you want people to know about the vaccine? What do you want people to know about COVID-19? Starting with you, Dr. Edwards.
What I would like people to know is that I'm pretty sure at everyone at some point has lost someone to this virus that has been close to them. So if this is something that we can do um, to prevent the spread of this virus, for us to be able to come down off of this high anxiety state that, oh my gosh, what if I get this virus, to be able to go to family gatherings and like give somebody a hug again and have that human interaction again that a lot of us are longing for, and without, or having a lot of, anxiety and depression about, and with pregnant moms, like being concerned about them contracting it and passing it in utero. Like I really hope that from our experience, from us telling you that we've gotten the vaccines, we haven't had any major side effects. I hope that you'll be able to trust the medicine, trust the science, and get the vaccine.
Thank you. Dr. Floyd?
I guess my biggest thing is that I would want to try to tell everyone is that, coronavirus, COVID-19, we're talking about an infectious disease. So the information that we have been providing are the things that you need to listen to, and you can do further research. But be careful listening to other people who are not involved with looking at research, practicing medicine, administering these medicines, administering these vaccines. I know there's been a lot of concerns and conspiracy theories and things people want to talk about, but when you're talking about an infectious disease, at the end of the day, we're all at risk. And the only way that we can get control of such processes to give ourselves better chances to get back to normalcy is to become vaccinated and also continue to wear your mask, hand sanitize, and social distance. We're not all perfect, but continue to do the things that you need to do to protect yourselves. Thank you.
Dr. Jerome?
I would say my message is that we're at war. It's been an 11-month war. I haven't seen my parents since last February when I went home from Mardi Gras. And I would say our only armamentarium against this war is to continue the things that Dr. Floyd just said, but it's to get the vaccine. We've done things your way for 11 months, the non-mask wearers, the non-social distancers. And I think it's time for folks to stop politicizing those measures and get the vaccine when your name is called, if for nothing else, you live in this community so that I stay here and I'm alive to take care of you.
Thank you. Dr. Glass?
I would say that although you're hearing a lot about this being a new kind of technology that was used to bring this vaccine to market so quickly, it's not an untested technology. So just because it's new doesn't mean it's untested. So I would advise you to go ahead and get that shot, because the consequences of not getting it far outweigh the consequences of any side effects that we've even thought of, much less had. You're really taking a risk by not getting the vaccine, and you're going to be in a lot of trouble if this thing gets you.
Thank you. Dr. Howard?
I would just say, I think we all understand some of the hesitancy and fear, frankly, that a lot of people have around COVID and the vaccines. But I think we've given some good information here. I think the CDC has good information. I think the Department of Public Health has good information. I would encourage you to get that information. If you are on board or have received your vaccine, I would encourage you to be patient with your family members, your coworkers, your friends, but persistent in encouraging them to get the vaccine. And while you're waiting for your tier, put your mask on, put 2 masks on. Make sure you have a good fit so it's not all loose and flowing all out the sides. That's the least you can do to protect yourself while you're waiting for your turn to get the shot.
Thank you. Dr. Lucas?
So this has been the first time that an illness or an infectious disease where, you know, everybody wants to think that they know as much about this as, you know, as the scientists, as the experts. And so it's just mind-boggling. But what I do want to say is that, you know, we do need to follow the science and know that, you know, we're all out here to help you. We're not telling you to do anything that we're not doing ourselves. And we're tired of wearing these masks as well. We are tired, but we mask up, we gown up, we glove up, and we go in to the fire every day to help you, to do the best that we can, to help as many people as we can. And if you think you're tired of wearing a mask, just going out grocery shopping, just imagine we're putting that thing on at 6, 7 a.m. and wearing it until 5, 6, 7, 8 o'clock at night, 4, 5, 6 days a week. We are tired as well. But, you know, we have an out. We have, not an out, we have this tool in our, we have this tool that in this war that we can use. And so we just have to take advantage of this opportunity. And like I said, I was absolutely thrilled when the vaccines got approved, when they became available. We are hopeful. And we do want to give you hope too, that we are hopeful that as more vaccine becomes available and more people will take advantage of this so that we can all get back to normal, to get back to our families, get back to book club and all of those things that that we would normally do. Thank you.
Thank you. And Dr. Pham?
So autoimmune diseases are not preventable. Infectious diseases are. So if you can take control of your health, this is the most obvious and logical way to do it. Big thing is trust your health provider who's using evidence-based medicine to treat you. Don't base your judgment on Facebook, social media. Trust those who've done the research and are here to help you. Protect yourself, because ultimately you're protecting your loved ones. It's not just you, it's everyone else around you.
Thank you. And Dr. Prempeh?
So personally, I would say that in my however many years of practice that I've been working as a physician, this year has probably been the most miserable year of my life in practice. It's just been horrendous, looking at the sheer numbers, looking at the degrees to which people are so sick. This has been a very difficult time, and I can speak for my colleagues. This has been tough on all of us at work and outside of work. This virus is very infectious, obviously. It's very dangerous. You know, as everybody else has talked about, don't rely on conspiracy theories, Facebook, and cookie people saying crazy things. Trust your physician, trust your primary provider. Mask up, social distance, wash your hands, glove up. When it's your turn to get the vaccine, get it. As we already said, the risk of getting sick and getting permanently debilitated or dying from this far outweighs the minuscule amount of side effects or rashes or minimal things you can get from the vaccine. So it's really important. I mean, this has been a tough year, but we're all fighting this. We're all trying to stay disciplined. So stick with it. Don't give up.
Thank you. Dr. Spraggins?
I'd just like to piggyback on Dr. Prempeh. This has been the absolute worst year of my life outside of the year that my mother passed away. It's been the only time that I was glad that she was not here on earth. It's been the worst year from a workplace standpoint. I mean, just you know, you're used to intubating folks and they get their knee fixed and they go home. Now you intubate people and you check on them 2 days later and they've left but not gone home. And from a personal standpoint, gosh, I am usually out of town more weekends. 75% of the weekends, I'm not in the city. I've been in this house with just 2 pets and hadn't seen any of my friends on a regular basis or touched anybody. My aunt has lung cancer and I can't go see her. She's 84. But one of the things I would say is we are nearing the finish line, and wearing a mask for a couple more months, washing your hands, which you should enjoy that anyway. It's good to be clean. And staying 6 feet away so that in several months, maybe you can be 6 inches closer to every single person. I mean, I'm looking forward to touching a bunch of people. And that's, as most of the people know on this panel, that is not my thing. So we're nearing the finish line. We've got something that can get us closer to the finish line. Go out, get your vaccine. But in the meantime, stay the course.
Dr. Larson.
So it's been almost a year since we've had COVID in our lives. And if you look at our state statistics, only almost 15% of the community, the citizens of Georgia, are immune. That's not enough. I mean, it's been a year. So this vaccine is our only way to push that immunity to us. It's been a year, we've lost 15,000 Georgians so far. It's been a year, we've lost almost 500,000 Americans. So we have to do this. This vaccine is the only way that we're gonna slow this disease and slow the deaths that we're seeing. And you know, if you look at the number of people, I keep reading this statistic that drives me crazy when people say, well, only 1%, I mean, 99% of people recover. Using our hospital statistics, 13% of people that test positive are sick enough to be hospitalized. That's not a small number. That's not 99% do fine. So get your vaccine when it's your turn.
Let me just end by thanking Mr. Stocks and the NAACP for agreeing to support and sponsor this program. Without that platform, this would not have been possible, and we are appreciative of that. To all of my colleagues, thank you guys for giving up your time and expressing your expertise. I think you gave a lot of valuable information that can be utilized to help individuals make decisions regarding getting vaccinated or not. I want to thank the Tanner Health System for helping us develop a platform in which to reach other individuals and to reach people that needed to be reached, and for spearheading the vaccination programs in our community. I mean, without that leadership, we may not be where we are. We're not where we want to be, but we're trying to get there. And we thank them for the efforts that they put forward. I want to thank the technical support, Gila Gonzalez and Deidre Rice, for the logistics. Many of us are not computer savvy, and we appreciate having a program that gives us the opportunity to reach everybody in a professional manner. And for all of the participants that have joined in this discussion, thank you for your questions. We hope we provided you with good answers. We are not perfection, but we follow science, as someone already indicated. And if you have questions, you can send it to the NAACP website, and we will get those questions and get some response to you in a timely fashion. So again, thank you. And that's all I have, unless Dr. Lucas has anything else you'd like to say.
No, I'd just like to say, please share this information with your families and friends. If you've already received your vaccination, just share the information with everybody. Let's do this. We can do this. We got this.
Thank you all, and good night.
All right, good night.
Good night.